educative edition of Roadway to Health, an hour-long program brought to you by the Ministry of Health, of course designed to educate, inform, and empower Liberians about issues relevant to your health. Today is Tuesday, the 30th of September 2025, and driving you through today's edition of the program are Angela Noah and
Benutole.
we have Augustine Kaima here, making sure that you get access to this program through the Ministry's official Facebook page. However, when you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always a pleasure to be here with you. For those of you joining through the Ministry's official Facebook page, we'd like to encourage you this morning to like and share the live stream. Invite a friend to watch along with you, and to our dedicated radio listeners, increase the volume of your radio. Invite a friend or relative to listen along with you. Well, this morning we have invited the malaria control program and that of the expanded program on immunization. They are collaborating this morning to provide valuable insights on the upcoming launch of malaria vaccine across 9 counties. So we'll take a very short break to be right back.
Become a parent before your time. You suffer too much and regret in life. You kill your dreams and expectations of becoming a better person. So to protect your future and live a happier life.
Welcome back and thanks for rejoining us. We now join Beno Dolly to introduce our guests.
All right, a pleasant good morning to everyone that is listening and watching through the Ministry Facebook live page. And for today in our studio, we have our two guests. That is Dr. Choko Washington. He's the program manager for the National Malaria Control Program at the Ministry of Health. And we have Dr. Yua A. Nima, and he's the acting program manager acting program manager for expanded program on immunization at the Ministry of Health. And today they are going to be driving us through the topic on the official launch of malaria vaccine in 9 counties across Liberia. So stay tuned to not change to that. So Angel, good morning. Good morning to our guest.
Good morning, and thank you for the opportunity given us to be here.
Okay, let's begin with Dr. Nima, the acting program manager of the expanded program on immunization. Good morning. Welcome again to Radio
A pleasant good morning to all of our mothers and fathers, our caregivers, and our grandparents out there in Radio Land. Good morning to our hosts here in studio, and good morning to our bosses at the Ministry of Health.
Dr. Washington, good morning. Welcome.
Okay, thank you.
Thanks. I mean, I really appreciate the fact that you were able to make it.
Yeah.
Exactly.
I can tell.
I'm under the weather, but I have to come because of the significance of this event, and so I have to avail myself.
Thank you.
Thank you very much.
So, let's begin with okay, Dr. Washington. Let's begin with Dr. Washington.
Yeah.
So we are talking about the launch of the malaria vaccine across counties, selected counties. But before deepening our discussion into that, I want us to firstly establish what it is that you know malaria is. Even let's talk about the disease itself before deepening our discussion.
And to begin, malaria is a disease that is endemic to our country. It is something that almost everybody is aware of. Sometimes we mistaking it for other disease entity for malaria. Of course, it is a mosquito-borne infectious disease, a protozoan parasite, sperm being made by infested female anopheles mosquito. And after that happens, it of course it presents the symptoms and signs that we know to be, for example, fever, chills, nausea, of course, anemia in extreme cases, and respiratory distress, sometimes coma, and can lead to death if not treated in time.
Okay, so you, Dr. Yua. All right, so that is what is malaria? Okay, so you said is being transmitted through a female mosquito.
Infested female Anopheles mosquito.
So how does the bite lead to malaria?
Okay, somebody must have the disease in the environment for the malaria. I mean the Anopheles mosquito to get out from the person and then transmit it to another person. The mosquito, the infested female Anopheles mosquito will transmit what we call sporozoans, which is the infectious stage of the disease, to the person as it bites the person, and that sporozoan will travel through the blood to the liver, and in the liver it will multiply and produce what we call merozoans. The merozoans will now leave the liver, come out in the bloodstream, and begin to attack the red blood cells. In the case of P. falciparum, it attacks both old red blood cells and then the young red blood cells, which we call the reticulocytes. That makes P. falciparum the most deadly of the species, parasite species mosquito of the disease. And so that's the one that we have in Liberia. And so you find out that if a child, for example, the owner has malaria and that child is not treated promptly, it leads to complication. As I just told you, it may lead to anemia, it may lead to coma, it may lead to seizure. It may also lead to respiratory distress. Jaundice is one of the things we see in extreme destruction of red blood cells. Because remember, the merozoal stage of the disease would attack the blood cells, destroy the blood cell massively, and the liver will not be able to conjugate the dead red blood cells, and that would be manifested in the sclera. The person will have yellow, what we call the etheric sclera, and of course that's a complicated condition which shows that child, if not treated promptly, will develop anemia, and of course anemia will lead to confusion, to coma, and of course inevitably death.
Okay, so to you that you are, you know, Angel, at first I only know malaria to be malaria, but I didn't know that you have something that can cause malaria.
Like,
So I just feel
not
it's
just something, but a
a particular mosquito. That's the thing.
A female
female mosquito.
A female mosquito. So it's a good thing having you today on the platform, and to you that you are. So this is my question, right? So can malaria be prevented?
Yes, malaria is both preventable and treatable. For the preventive aspects, we advocate for a clean and sanitary environment. So as much as possible, you cut the grass around the homes. You would not allow the water to sit or become stagnant. So if you have a drainage, you can help by cleaning and opening the drainage such that the water flows, because the mosquito will lay their eggs upon the stagnant water sitting in buckets and old tires, and then they will breed there. The next thing we use to prevent the spread of mosquito is to sleep under the insecticide treated mosquito nets. So we have all of the homes in Liberia have received mosquito net during our last distribution. All of our mothers and sisters that attend the antenatal clinics, once they are pregnant, are issued insecticide treated mosquito nets. So we advocate that if you sleep under the net properly, it's one of the means to prevent malaria. But more recently, we have gotten an addition to the preventive measure, and it's part of what we are here today. We have a new preventive measure, which is the vaccine, a medicine that is introduced into the body system, and the body system works with the medicine to recognize the disease in the future. That when it should come in contact with the disease, the body is better prepared to fight and overcome the disease. So Liberia has introduced the malaria vaccine in 6 counties in the southeast. We did this last year in April. Having learned from the successes of the southeastern counties, we are now on the 3rd of October, Friday this week, going to officially expand the malaria vaccine to the remaining 9 counties and thereby affording all of the children of Liberia, everywhere in Liberia, an opportunity to be protected against the malaria disease.
So coming to the lunch break, the one that was introduced, that is the first phase. You said in 6 counties at first. So in the southeast. Yeah, so what are the 6 counties?
In 2024, in commemoration of World Malaria Day, April 25th, the Ministry of Health moved to Riverside County, and children who were qualified received the malaria vaccine. Thereafter, we expanded the vaccines to Sino, Grand Cru, Maryland, Grand Juda, and River G. So since April of last year, we are happy and proud to report that over 38,000 Liberian children have been vaccinated against malaria. This year we went on a supervision visit in Riverside, and we went into the communities and we were able to see about 15 children who on the first day received the malaria vaccine, and they completed all 4 doses in the schedule, and they were all alive and well in the community. This is a success story for Liberia, and we wish to share it with the entire nation.
Okay, so Dr. Washington, let's talk a little about the signs and symptoms of malaria and the age is more vulnerable to getting the disease.
I think I made mention of some of the signs and things I will still repeat myself.
Okay, all right.
And I think we talk about fever is one of this most of the time the first thing that the mother will recognize. We also will have vomiting, we have headache, we have diarrhea, especially in the under 5. So in extreme situation, we have seizures, coma, journals, convulsion, respiratory distress, etc. But it's mostly seen people who are very highly predisposed the under 5. The pregnant women because of the low immunity during pregnancy, and of course people with other disease conditions like HIV, people who have cancer, people who are on certain medications, steroid medications, for example. These people are very highly predisposed, and of course people who live in low epidemic or who live in a low transmission zone. Of course, if you live in a country where malaria is not considered a disease there, and you travel to an endemic country like Liberia, of course, you are very highly predisposed. And because you have not developed the necessary immunity to fight off the disease. So that's.
So for the malaria vaccine, what is this malaria vaccine?
Okay, currently we have 2 malaria vaccines pre-qualified by the World Health Organization. The first is the one we call the IRT-SS, which is a 4-dose malaria vaccine. The second is the IR-21, which is a 3-dose malaria vaccine. What we are using in Liberia is the 4-dose malaria vaccine, the IRT-SS, administered ideally at 5 months, 6 months, 7 months, and 15 months, respectively. The vaccine is said to be important because it prevents not only malaria but hospital admission by between 30 to 35%. It reduces the severity of the disease, and of course, not only the vaccine that we now have as the major tools, but we also have NET. Remember that the name I just spoke of, NET, that the child must sleep on the net. I'm happy to say here that In 2024, we were able to distribute over 2 million insecticide treated nets to Liberia, the population. We had a coverage of 88%. We are encouraging our people to utilize the net. We realize that net asset is high, but utilization is very low because of various reasons. Some people feel that when they sleep under the net, they feel hot, it's heated. In the southeast, most times people use the net to cover their body. I've seen that happen in the southeast. I can clearly say that. And when that is done, it creates fear in other people to sleep under the net. So we are trying as much as we can to intensify our social behavior change intervention, because it's one of the areas where we have seen some gaps. A lot of people have not begun to understand the importance of using the net, and we now have engaged the communities, the radio station. We continue to enforce awareness, sensitization in the various counties. We are doing that as well in the non-counties where we will soon start to scale up the malaria vaccine. We're making every effort to make sure that Liberia is safe. The 105 material are safe. The pregnant women, so that we can have a vibrant and the country free of malaria.
So thank you so very much. And so you, Dr. Neiman, who should be vaccinated against malaria disease?
The malaria vaccine that is introduced in Liberia is for children who have not reached the age of 2 years old. We begin the vaccination, the earliest is at 5 months. And then you take the first 3 vaccines 4 weeks apart. And the 4th vaccine will come at least 6 months away from the 3rd dose. The goal is that each child who is enrolled on the vaccination program for malaria stays enrolled and completes all full vaccination before the age of 2. You just listened to Dr. Washington saying that under the age of 2, our children have not developed the immunity against the malaria disease, and if they contract the disease, they are more likely to have the severe form of the disease. So this is the reason why we place the emphasis on this, our age group. We recognize from the vaccination program that this schedule brings additional visits to the mother and the family for them to bring the child to the hospital. In the past, there was no visit at 5 months, there was no visit at 7 months. But now we are asking them to bring the babies back to the hospital for vaccination. We know it is more visitation, but it confers additional protection to the baby. So what we have learned from other countries that the malaria vaccine was piloted in, such as Ghana, Kenya, and Malawi, is that if in a year's time one baby under 5 was having to get sick about 4 times with malaria, for those who took the vaccines, the first thing it did was that it reduced the number of times you contracted the disease. So in the entire year, those who took the vaccine, maybe once they will get the malaria. And even for those who still came down with the malaria disease, the severity, so their malaria did not progress to the severe malaria as described by Dr. Washington, the one with the low blood, the baby jerking, baby going off, and unfortunately progressing to a fatality. So this is what we want to confer and offer to all of the children across Liberia. So beginning the 3rd of October, next week Friday, the new 9 counties, which include Bapolo, Bombing, Cape Mount, Monserrado, Grand Bassa, Margibi, Bong, Lofa, will also have the malaria vaccine in their routine schedule. So this means any facility near you, government clinic, government hospital, private clinic, private hospital that is giving baby vaccine will also have the malaria vaccine. They will be there every day. the clinic is open. So we're asking our parents, our caregivers, our loving mothers, our supportive fathers to take this message to the community that there is a new vaccine that the Ministry of Health and the government of Liberia has introduced. It's called the malaria vaccine. Children who have not reached the age of 2, beginning at 5 months, are eligible to take the vaccine, and they are required to take all 4 doses in order to have the full benefit and protection against malaria.
So, okay.
Sorry, in addition to what Dr. Nima has just said, malaria vaccine is important because it has a mechanism. The mechanism of action of the vaccine is that it interrupts the pathway between the sporozoites, leaving and going to the liver. In other words, it blocks the infested sporozoite from reaching the liver to multiply and produce merozoites. So that is very, very important because in order for the disease to manifest itself, it has to go to the liver to multiply and then come out of the liver and begin to destroy the red blood cells. And so this vaccine has the mechanism of action, which is to stop that from happening as the mosquito bites and ingests the sporozoite into the blood, into the blood of the victim. That sporozoite is not going to travel to reach the liver. The vaccine is going to block that from happening, and so it's one of the important tools that we have to be proud of, that we must utilize to the best of our ability and make sure that our children receive the vaccine, because the vaccine is safe. And of course, like what Dr. Nima said, the vaccine, when fully taking, the child is not going to develop, it's not likely that the child will develop a complicated form of malaria when they get malaria.
So, Dr. Nima, if a parent takes his or her child for the vaccine, and then there are doses, right? I'm trying to get the intervals for the doses. And the child takes the first dose of the vaccine, and then maybe they miss the second one. What they need to do in order for that child to complete the doses?
Thank you for the question, Angie. And for our mothers and families out there, I will try to explain it like this. So the first scheduling is what we say the child is encountered on schedule. So we meet the child at 5 months and they take the first dose of the malaria vaccine. They are given a return date to come back 1 month later. So when the child is 6 months, the family brings the child back and they take the second dose. 1 month later, they bring the same baby back and the baby takes the third dose of the malaria vaccine. And then we schedule the 4th dose for when this baby is 15 months. So at 15 months, the baby will receive 2 vaccines. They will already do for the measles second dose, and they will get the malaria 4th dose at 15 months. But we're saying that anywhere between 5 months and 15 months, the first dose of the malaria vaccine can be initiated. Let's say your baby is already 7 months, 9 months, or 1 year, 2 months. What do we do? I'm sure this is the question some of the parents are having out there. So once the child is still between 5 months and 15 months, yes, we will start the malaria vaccine. So wherever we encounter you, we will give you your dose 1 on that day, and we'll give you a schedule 1 month later, come back for dose 2, 1 month later, come back for dose 3, 6 months later, come back for dose 4. The goal is to ensure that the child gets all 4 of the malaria vaccine before they reach the age of 2. So even if we start you at 15 months, you will still take all 4 doses before you reach 2 years old.
So how the malaria vaccine have side effect?
I would like to emphasize on the safety of the vaccine first, and then in the latter part of the response, I will come to that. So before introducing this vaccine in Liberia, the World Health Organization, WHO, which is our big people for medicine all over the world, tested this vaccine in the lab, and it showed that it had no harm to humans. And then in 2019 to 2022-23, they started to test the vaccine in humans. So they vaccinated over 2 million children across the first 3 testing countries. They were Ghana, they were Kenya, and Malawi. And those children who received the malaria vaccine during the test phase proved that one, the vaccine was safe in humans and that it conferred adequate protection against the disease. It was because of this that the WHO have approved this vaccine to be used globally across the world. So Liberia is using the same brand of vaccine that is manufactured there, the same brand that is given in other countries that have the high burden of malaria. So this is the same vaccine that we are using here. Locally, what have we seen in Liberia? Since it was a new vaccine, we were introducing it. We said that in 2014, last year, we introduced slowly in the southeastern counties, because when we looked at the malaria indicator survey of 2022, it showed us that in those 6 counties, they were having a high number of children who tested positive for malaria. They're also seeking treatment for malaria. So we introduced the vaccine in those 6 southeastern counties: Riverside, Sino, Grand Cru, Maryland, Grand Jide, and River G. Over the years, since 2024 April, Ministry of Health have vaccinated over 38,000 children in Liberia. And by and large, we are proud to report that there has been no major complication or side effect documented or reported attributed to the malaria vaccine. So this is the first issue about the safety profile. Now, as with all medicines, yes, there is a small possibility of side effect. Even if you drink water and you drink it too fast, you will choke, you will strangle, you will cough. If you run it and you drink the water, you will spit it out, you will vomit. So yes, there are known and anticipated side effects. The vaccine is an injectable, so there will be pain at the site of infection. Children after receiving vaccine are expected to develop a mild fever, low-grade fever. The skin will get hot. We'll tell the mother to observe. Over 2 to 3 days, the fever will go down by itself. Most of them will not require any treatment, any medication. So these are anticipated side effects. We still tell them that if you take the vaccine and you observe any abnormal symptom in the baby, do not keep the child at home. Come back to the hospital, come back to the clinic. The doctor people will look at the baby and provide you help. And then they will report this to us, and then we will investigate and find out whether this was another issue different from vaccine or if this was vaccine.
In addition to that, we haven't had a situation where we have lost a child or so because of the vaccine. The vaccine does not have deleterious effects, and as we have seen, it is safe. And we should be able to encourage people to make use of the vaccine. Also, at the time the child is going to receive the 4th dose of the vaccine, the child is also going to receive a net. A net as an inducement, so that the mother they can bring the children for vaccination. So at the 4th dose, at the receipt of the 4th dose, the child will receive a net. And that's one of the strategies that we put in place to improve coverage of the vaccine.
Okay. So, Dr. Washington,
Yes.
you're talking about nettle. So if you finish giving the vaccine, some of the parents might think the child doesn't need to sleep on the net again. So please verify that after the vaccine, what is they need to do?
They still must sleep. The children must sleep under the net as before. They should, like that Nima said, the environment must be clean, stagnant water should not be there, the grass is cut the grass.
Yeah,
And of
that's what
course,
I will say.
the vaccine is just one of the tools that we're using to make sure we fight malaria. So it's being used in combination other tools like we said, nets, of course, the treatment itself. Remember, the child is sick, we do the test and then provide medication. That's another way to treat the child. But above all, like Dr. Nima said, the child must continue to sleep on the net as much as they receive the malaria vaccine.
Okay. But Dr. Nima, how affordable is this vaccine? And for the benefit of our listeners.
Thank you, Angie. That's a very important question. So the vaccine is absolutely free of charge. There is no money in any vaccine business for children under 2 years old in the Republic of Liberia. So the vaccine will be in each and every clinic and hospital near you in all of the counties across Liberia. Every county have the vaccine in county, in the facility as we speak. All we are asking the baby mothers to do, the grandmothers and the caretakers to do, is to take the children who are between 5 months to 15 months to the hospital and say, yeah, the baby people talking about new vaccine being, so we bring the baby in. The doctor people are working in the hospital will check the baby age and we give the malaria vaccine free of charge. No money business inside. They will give other childhood vaccine that our baby is supposed to get and they will show you the time you're supposed to come back.
I like the way you put it.
Very
Very simple.
Yeah, very simple. So the malaria vaccine is free, yeah, my people. So okay, so after a child is being vaccinated on the first time, so can this child, while awaiting the second dose, can this child still be affected with the malaria disease?
Yes. So we are saying that to get the full benefit, to derive the full protection from the malaria, you need all 4 of the vaccine. And it takes at least 9 months interval to get all 4. 1 month, at 3 months, then at least 6 months. So yes, you can still receive first dose malaria and still get the disease. But what we are looking for is that the more vaccines you receive, the less likely you are to contract the disease. And even if you get the disease, it will not be strong on you, it will not be serious on you, it will not make you be very sick, because your body has been empowered somehow to fight back against the malaria. So while you are developing that immunity, this is why we are advocating that you continue to combine all of the preventive measures available to you. Clean the environment, sleep under the mosquito net. If you think you are sick, the baby start having fever, go to the hospital, they will check the baby, do the malaria test. If the malaria, we treat for malaria.
I think our community leaders have some roles to play here.
Yeah.
Are you reaching out to them, Dr. Nima?
The Ministry of Health works through the county health teams, and right now we are in all of the counties having meetings with our market women, our traditional leaders, our town chief, our community chairmen. We are giving them the same information, and we are happy that most of them are listening to our national radio station, ELBC, right now. So we are providing the right information to them. We are answering the questions, and we are asking them, because they are the trusted leaders at the community level. Some baby man will come and say, oh, market superintendent, oh, community leader will hear say the vaccine people say, we go take new vaccine. You know about it? Then this is when the community leader can confirm and say, yes, so Ministry of Health say they bring new vaccine called malaria vaccine. That vaccine good for the children there. So carry your baby there, the baby will get malaria vaccine.
Okay, then I think we should open the phone line.
Yeah.
So,
And-
Dr. Nima,
Sorry, if we open the line, lest we forget here, we targeting more than 180,000 children in the second phase of the vaccine.
okay. Alright, so let's open the phone now, Pendo?
Yeah, sure.
Because we want more people to call, because our parents have a lot of questions. So if you just join us, you are listening to Roadway to Health, and our long program brought to you by the Ministry of Health. And we are in studio this morning with our health experts, Dr. Washington and Dr. Nima. We are talking about the malaria vaccine that is about to kick off in the country. To be a part of this conversation, call us on 0880 514 096, 0880 514 096, and
0775670376, 0775670376 are the numbers to call.
yeah, so these are the numbers to call us this morning. Be a part of this conversation. We have our first caller. Good morning.
Morning.
Your name and where do you join us from? I'm fine. What's your name and where do you?
Calling from Jacobstown.
Oh, okay.
So, thanks to the doctors in studio for the awareness of this malaria vaccine. But you know, one thing that I'm sure will happen in our country, even though they have given the age limit of the children that should be taking the vaccine, but I'm quite sure they will take children that are above the age. In that case, what will happen if somebody, a child that is above the age, takes the malaria vaccine? Thank you.
Okay. All right. Thank you. Good morning.
Good morning. Your name and where you calling from? Let's hear you.
Okay, I think about it. I think in a my thing is this I think I'm going to you hospital. You will not expect me because this time around we go to the hospital to put us walk with God as we can walk if I everything that we use there or we say go to the area as everything is really hospital. In general, the Lord really committed, you know, in career. That is why we're making help them with any pathology or any drug to work with it. We're everything in our hospital and pay for it. So,
Okay. Okay.
All
Okay.
right, thank you.
Okay. Let's take this person. Good morning. Good morning. I think we missed that call.
Good morning. Yeah, you live. Let's hear you. I think we lost that.
Okay.
Good morning. Yeah, you live. Let's hear you.
Yeah, my name is Dominic Morrow and I'm calling from Corway. Let me say thanks to the student guys for their brilliant explanation. We have gotten to know that indeed there's a vaccine right now in Liberia for children under 2 years of age. But then my disappointment, and I would like to put it in a question form. Well, why is it that it has to be only for children and malaria does not only affect children?
Okay.
All right.
To have a vaccine, everybody.
Okay.
Okay. Okay. 088051409 is 0775677376 are the numbers to call and be a part of this conversation this morning. While we await callers, our guests can start responding to some of the callers' concerns.
We are happy for the calls that we are getting. I will begin my response with the latter. Our brother from Caldwell, Dominic Molu, asked why only children are the ones to benefit from malaria vaccine when in fact all ages are affected by malaria. So the children are the most vulnerable in the population. Age under 2 have not developed their immunity against the disease yet. So for us, the big people, since we were born, we have encountered malaria before. It has bitten us. Our body, to some sense, have gotten a means of fighting against the malaria. Whereas those small babies, the 5 months, the 6 months, they don't have that natural immunity as they're reaching 6 months. Whatever protection they got from the maternal antibodies are wearing away, and they are developing their own defense system. So this is the age that we introduce the vaccine to help those children to develop their immunity. And we want to give all 4 of the doses before the age of 2 years old. To our big people, we are still advocating and encouraging you to use the other malaria prevention strategy. We say you should clean around the house and you should sleep under the mosquito net. Whether you big or you small, it will still help to prevent us from getting malaria. Once we get sick, we start getting the fever, we start shaking in the evening, our mouth bitter, we now want to eat, body pain, joint pain. You go to the nearby hospital, they will do the malaria test for you. If that malaria you get, they will treat you. So those are measures that we can use. But the vaccine has come on specifically for the small babies, the most vulnerable in our population, before they reach the age of 2, we want to add another protection for them.
Okay, so let's take more calls. We have another call. Good morning. Yes, good morning. Your name, where do you join us from?
My name is Isaac here, trained malaria expert for the mental and literature Liberia.
Okay, go ahead.
We are very close. But I have few questions and few concerns about our presenters. Firstly, I want to say thank you very much. But we talk about side effects of drugs. And we know that every drug has a side effect. But then, when we were working with mental initiative at that time, there was a system referred to as pharmacovigilance. And pharmacovigilance is a process by which you are not expecting for the malaria to, for any drug to work, to have an effect. And that is the other effect. My question there is, do they still have the means of the pharmacovigilance? Because I remember we drew a checklist, and I was one of those that produced that checklist in the mental initiative.
Okay.
And on our monitor evaluation in the field, we need to carry them because you are not expecting for something to happen. But when it happens, you can take precaution.
Okay.
That's my first one.
Okay. Oh.
I see they are using that on medical terminology that my old man that is in Basi Dia number 3 Sigram Basokante, that he will not be able to understand. Like for example, when he talks about
Okay.
yeah,
Okay. Thank you. Let's take another person. Good morning. Good morning. Your name and where do you join us from?
I'm Franklin People calling from Sector of Rochester County.
Okay, go ahead, Franklin.
Yeah, thanks. I want to extend my thanks to Dr. Washington and the others for the update. I aim of her work for CSS to be back. We just called to testify to the malaria vaccine. We initiated it and it's working well with us here, the community who do cooperating. And since we started administering the malaria vaccine, we haven't experienced any serious issue. The AEF people were expecting. So we just want to add my voice to their voices and ask other people to cooperate so that we can continue to fight against malaria.
Okay.
Yeah, I think we should go
Good
past
morning.
the course.
Good morning. Yeah, go ahead.
This is Matthew Derby, calling from Greenville, Toronto County. Yes, you spoke about it. You spoke about the severe fever right after the vaccine with the minister. And my child will be 25 months tomorrow. From the initial stage, from the first day up to this 5 months, for every time she takes the regular vaccine, she experienced that fever for 3 days plus. And then tomorrow, she'll be 25 months, she's able to take vaccine immediately tomorrow, according to her mother, because she told me this morning. Then right after the the vaccine will be administered on the care. Right after, then we have to take that vaccine again. Is there a possible that we wait, according to you said, the children between the ages of 0 to 13 months will be taking the same doses or we wait a bit that my parents want from you.
Okay, thank you. Dr. Nima, Dr. Washington.
Yeah, thank you very much. I'm going to address the question posed by our brother who spoke of pharmacovigilance and the rest of it. Indeed, we are following closely as we administer the vaccine. We have all forms we call the AEFR forms, the adverse effect following immunization. Whenever we see that kind of adverse impact, we document it. The child is of course referred to the hospital for appropriate attention. So we are not unmindful about that. It's taking place. And quickly, the father who just spoke about fever. Fever is one of, is precisely what people appreciate after the administration of the vaccine, because the vaccine is an antigen. As it is introduced into the body, the antibody, remember antigen-antibody reaction, and the body will recognize it as a strange, foreign body. It will try as much as possible to overcome it. And like Dr. Nima said, as soon as it overcomes it, in the future it will recognize any of similar antigen coming, and then it will counteract it. So it's the body's own way of saying what I have received is strange and I have to fight it to overcome it. So the antibodies are the soldier men in the body. The vaccine is the foreign object particle being introduced, and the antibodies will fight to overcome the antigen, so that the body develops the immunity that we're talking about. So it's a normal thing, except where it is extreme, and we can draw the attention of the health people. But again, we encourage you to bring a child to the hospital if you notice that. I also wanted to add, somebody was talking about will the vaccine not be sold? The vaccine will not be sold. The vaccine is free. Other people in other countries pay for the vaccine and send the vaccine to us. We're not going to sell the vaccine. The vaccine will be free. I think the person was trying to allude to the revolving drug fund, where people are now being asked to pay small money in the hospitals and clinics so that they can be served, so that the necessary pieces of the equipment or the commodities needed will be readily available. Oftentimes people go to the hospital, sometimes you say, oh, no, the medicine finished, and we haven't gotten the supply. And this time around, we now trying to move away from the free thing, because I mean, of course, for so long we've been having free medical services, and as you see things evolving now, the financial landscape is terrible. Most of the partners have reduced support or cut off support dramatically, drastically, and so we as a country must try to introduce small fee. Let people pay small money as they go to the hospital, so that small money the hospital can use it and buy more medicine, so that when we have patients coming in, we wouldn't be able to tell them, look, no medicine here, go out there and look for it. In fact, the time people taking to go out and look for certain medication, it puts the patient at risk. Some patients can even die before that medicine can come. I can still remember myself, where sometimes we used to ask the patient to go and buy amoxicillin for us to do the surgery, because none we wouldn't find out at the hospital at a certain point in time. And before the relative can come, it's something different because of the distances they have to travel to get the medicine. So if people pay small fees and we are able to get what we need to work with in the hospital at the appropriate time to look at the patients coming in, I think it's good to do so. And we should be happy that at this time the government is trying to introduce that, so that as we go to the hospital, we are served and served appropriately.
Dr. Nguyen.
I would firstly like to recognize and congratulate my brother Melvin from Sino for being an outstanding and supportive father. Number one, he clearly stated the age of his child. He knows that the child has taken 3 or 4 vaccines before. He's aware that every time the child takes vaccine, the child has a small fever. He's even aware that tomorrow when the child turns 5 months, she's due for another vaccine. So this is how we want the male gender to be supportive in the family, to play an active role in the health of the children who are taking for vaccines. So thank you and well done, my brother Melvin. So yes, after the baby takes the vaccine, it is expected, it is known that the baby will develop a small fever. We say for 2 to 3 days the fever will be there. That means the body has accepted the vaccine, the body is working with the vaccine taking strong effect in the baby body. What we will be worried about, if after 3 days the fever is still there, or if during the 3 days different thing beside the fever, you notice anything different on the baby, then we say come back to the hospital so that we can look at the baby for you. But as you are inside now, the vaccine is already inside now, it's been there since last year. We encourage you to continue to keep onto the schedule. Tomorrow, please take the baby for the malaria vaccine, and we will all be praying that nothing bad will happen to that baby. To our brother with the AEFR question, yes, we follow. After we give the vaccine, we ask the health workers to, tell the parents, if you notice anything, come back to us. Because we are not alone. In Liberia, we have other regulatory bodies who are responsible for the medicines that we bring into the country. For example, the Liberian Medicine and Health Product Regulatory Authority, LMHRA, is also working with us closely. So we report this information, we co-investigate them, and we share our findings. Also, we told you that the vaccine was pre-qualified by WHO, and we have WHO in Liberia. So if there is anything we are observing about this vaccine in Liberia, we have to report it to WHO. They will want to know the same thing we see in Liberia. Are we seeing it in other countries? Are we seeing it? If it is so, then we can all compare and say yes. But thanks to all of our callers. The message is that the malaria vaccine is in Liberia. It's going to be launched on Friday in the remaining 9 counties. Children 5 months to under 2 years will take 4 doses to get protection against malaria. Thank you.
We got one question left unanswered, and that is the question as with children above the age, above the eligibility criteria. Somebody asked, what are we going to do? Remember, for example, the measles vaccine is given at 9 months and 15 months, respectively. So children coming after that time, they miss the vaccine, of course. But at a certain point in time, we usually have a campaign, and the campaign will capture whoever that missed the vaccine in the given required time, the given time. Again, for example, the hemopapillomavirus, we usually give it to the children, girls 9 to 14 months.
Okay.
This time around, we're going to be giving it from 9 to up to 18 months.
Okay.
So those who are missing, of course, will have catch-up campaign to come, and then we'll capture them.
Okay, we don't have time for parting comments, but I'll consider that your parting comments. And so, many thanks to our guests and our listeners for sharing valuable insights today, and also for your listening role. We have been your host on this program this morning, Angelina Noah, and
Then Dolly.
until next Tuesday, have a good day.
Thank you.
Before your time.